Hello, my name is Priyanka and this is Rosemary. We're going to deal the card number 3. The setting is emergency department and the scenario is I'm going to meet with a parent of an 8-year-old girl who has sustained an undisplaced fracture for her left elbow after falling from her toy bike. A plaster cast has been applied and the child is now ready to be discharged from the emergency department. And I'm providing the parent with advice on aftercare and healing process. And the child is of course not present here. So shall we start?
Yes.
So in this situation, the nurse is visiting the patient. So I'm supposed to introduce myself and also my purpose of visit. So we'll start?
Yes.
Okay. Hello, my name is Priyanka. I'm one of the registered nurses in this emergency department. If I'm not wrong, you're Ria's mother, am I right?
Yes, nurse.
Okay, so Ria has sustained an undisplaced fracture for her left elbow. Now Ria is in a plaster cast and she's ready to be discharged home. So very happy to know that, and I'm here to give information about the aftercare and also the healing process. You will be the primary carer, so I'm born to explain all these things to you.
Yes, nurse.
So before that, tell me, how are you feeling about taking Ria home?
I'm pretty much happy because my daughter is ready to come home with me.
Yeah, okay, I'm also very glad to know that. So I'll start with the care for the arm, okay? It is so important that while she's resting, elevate her arm, especially above the elbow. That will definitely reduce swelling, chances of swelling. And it is good to use a sling that will give her an awareness that the movement is restricted, and also that will help to immobilize her hand, okay? You can give her pain relief as required, but it's so important that regularly monitor hand and finger movement, okay?
Yes,
And I would like to tell you when to seek a medical attention immediately. When you notice that there is any compromised finger or hand movement, and when you notice a significant swelling or diminishing the sensation or color, changes in color, of if she experiences high temperature, in these situations, I would advise you to take her immediately to the hospital.
Yes, nurse.
Okay, do I need to explain it again because it was a long information?
Now, nurse, I'm currently aware regarding what you have mentioned right now, but I would prefer to take my daughter to the local clinic near our home so that the doctor or nurse can monitor her continuously. And there is a lot of advice to follow, and I'm a bit worried if I miss something in this.
I totally understand. As I've mentioned, it was a whole information, but try not to worry. Let me remind you that this medical knowledge is not required to take care of your child. All those things I've just mentioned is something that you can do at your best. And in fact, as a mother, you would be the right one to do all these things to your child. Okay. And, when you find these things are very evident, then take her to the hospital. Otherwise, you're the best person to care her. So, do you want any information about the cast?
I'm so sorry that I missed the information sheet which you have already provided for me.
That's totally fine. I can explain to you the importance of keeping the cast clean and dry. I'll explain it to you and I'll also give the sheet again. Okay? Yes. Try to keep the cast very clean and dry. That will definitely prevent the skin irritation and avoid any kind of infection. Okay? So, is there any other questions from your side?
Yes, as you already told, if I can't get it wet, then how will I take Ria to bath or shower?
Well, that is an important question from your side. I can tell you, I can offer you some methods to keep it dry. First of all, when you take her for bathing, then make sure that you cover it with a waterproof cover, or you can use a plastic bag sealed with tape. And I advise bathing instead of showering. That would be a better option. Okay? Yes. So these are the methods that you can adopt to keep things dry. I think that sounds sensible.
Yes, nurse. I'll follow the advice regarding the care of the cast which you have provided regarding my daughter's arm. And also, I'll bring her to the follow-up appointment in next 2 weeks.
Very good, very good. So, I would also like to remind you about the follow-up appointment, yes, which you have already said, but please do not forget that it is after 2 weeks to the local clinic. That's it.
Yes, nurse.
So, I hope you will be following everything in between. If you find anything missing or you can't remember anything, do not worry, you can ring us and we are here to help you. Okay?
Yes, nurse.
All right. Thank you so much.
Thank you.